I'm here to talk about the role of criminalization and the war on drugs when it comes to ayahuasca and other psychoactive plant medicines. My work has primarily been in the United States, where I'm based, so much of my talk will focus on this context, but I think the points are largely relevant elsewhere. For the past 15 years, I've worked towards drug policy reform. Earlier in my career, about 15 years ago, started working at MAPS when they were in a much earlier stage of their research process. And for the past dozen years, I've worked on broader drug policy reform efforts with the ACLU, the American Civil Liberties Union, and for the past 10 years with the Drug Policy Alliance in the United States, which I'm actually in the process of leaving this month. Our goal essentially has been to reduce the role of criminalization to the maximum extent possible in drug policy while improving public health and safety. I think it's important to acknowledge the context of the global war on drugs. For example, in the United States, which has the largest incarceration rate in the world, about over 2 million people are in prisons and jails right now, and about a quarter of them, about 500,000 people, are there simply for nothing more than a drug law violation. And in many countries around the world, drug offenses are the leading cause of incarceration, detention, and arrest. In the United States, there's about 1.5 million arrests every year simply for the possession or use of a small amount of drugs for personal use, which is the leading cause of arrest in the entire country. There's more arrests simply for drug possession than for all violent offenses combined. And in the United States, as many of you know, back in 2006, there was a positive ruling in the U.S. Supreme Court that provided some coverage and some protection for certain groups who use ayahuasca. The U.S. has some strong protections for religious freedoms. So the Supreme Court ruling in 2006, which was a case that was brought by the União de Vegetal Church, basically stated that groups that very closely resemble organized religions in the U.S. can be protected from prosecution and arrest. But I think it's important to acknowledge that most groups that are practicing in the U.S., even many that incorporate many aspects of or União de Vegetal or other organized religious contexts, most would not technically fit the definition of organized religion under the government's definition of it. And there's not been really large amount of arrests compared to with other illegal substances in the U.S., but as Natalia noted in her presentation, there have been some problems. So I think it's important to acknowledge that I think the harms of criminalization are often sort of overlooked or taken for granted in these kinds of contexts because it's sort of all we've ever known in a lot of contexts. And it's not just necessarily the arrests, it's the phenomenological experience of using a substance, which is very open to the power of suggestion. It changes when someone knows that what they're doing is a criminal activity. Someone is also less likely if they have problems or even not to talk about it with their doctor or with their family or with their community, which makes the process of integration oftentimes more difficult. So I think it's very important to acknowledge the role of criminalization, and particularly when it comes to the medicalization of drugs. As many of you know, groups like MAPS and USONA have been successful in putting certain psychedelic drugs through FDA clinical trials in order to get them approved for medical uses. But I think it's very important not to conflate medicalization with decriminalization and legalization. If psychedelic therapy is approved for prescription use in the US and Europe and other places, that would not do anything to change any of the criminal laws for people who use it outside of a very specific government-sanctioned, medically supervised context. And of course, that context that would be expensive, and most people would not be able to afford that level of therapy. So medicalization reinforces the dichotomy that we've had throughout our society for generations of more well-off people having good access to any drugs they want without the threat of criminalization for the most part, whereas people who are poor, people from more marginalized communities often face very, very harsh consequences for them. At the same time, while it's important to acknowledge the role of criminalization, I do not think it is strategic to always separate ayahuasca and exceptionalize it when we're talking about broader drug policy reform efforts. I think it's important to acknowledge that drug decriminalization has gained a lot of, drug decriminalization, I should mention, is not the same thing as legalization. Decriminalization means that people cannot be arrested simply for using or possessing a substance, but does not necessarily legally regulate the production and supply of it. And while there's no countries in the world that have legally regulated all illegal drugs, there's a number of countries around the world that have decriminalized drugs or are moving towards that. Portugal is the most well-known example. In 2001, implemented a very comprehensive system of decriminalization, and since then, addiction rates have gone down, drug use has not gone up, and the number of people being incarcerated and arrested for drugs has gone way down. Spain and several other European countries have some form of de facto decriminalization. Spain essentially never really criminalized drug use and possession in the first place. And so when in the United States, there's a lot of movement towards decriminalizing drugs, also in a number of other countries, Ireland, Norway, even in West Africa, Ghana, Georgia in Eastern Europe, Canada. There is a lot of political momentum for drug decriminalization, and moves are being made at the senior levels of government to implement drug decriminalization. And in the US now, there's also been a number of efforts just popping up in the past year or two to decriminalize certain psychedelic substances. The one that's probably got the most attention so far was in Denver, where just earlier or last month, an initiative was passed, the first ever in the US and I think in the world, to essentially decriminalize psilocybin mushrooms. And there's also efforts in Oregon to pass similar measures. In California now, in Oakland, there's a group called Decriminalize Nature that is working to decriminalize all natural psychedelic substances, including ayahuasca, ibogaine, psilocybin, San Pedro, peyote, and substances like that. But when it comes to when you ask the public, my work primarily is focused on communications strategy and figuring out what messages the public is comfortable with. And very consistently, when we poll the public on, would you like to, would you support decriminalizing the possession of small amounts of any drugs for personal use, or when you ask the public, do you support decriminalizing and stopping arresting people for the possession of small amounts of psilocybin or ayahuasca? The support is actually quite similar. So there's not the public largely still does not distinguish between different illegal drugs. And I think part of that is because it's a very small segment of the population compared to, say, cannabis or alcohol that uses ayahuasca and other psychedelic drugs. And I think it'll remain that way for the foreseeable future. I think we need to think about how, throughout the past 100 years or more, society has had ways of bifurcating people who use illegal drugs into categories of good and bad drugs. In the There are many types of, for example, opioids are legal to possess and use under certain circumstances. Methamphetamine is legal to use under certain circumstances, as is cocaine. And I believe actually the more dangerous a drug can potentially be, actually the more important it is to destigmatize and decriminalize people who use it so that they can come out of the shadows and get help if they want it. So while I don't think it's strategic to exceptionalize ayahuasca, I think there's certain things that for people who are considering running initiatives like this that are important to take into consideration, to include provisions that really prioritize racial justice and reparative justice so that these are not just symbolic victories, and so that they actually repair the harms that the war on drugs has caused over the past several generations. I think we can learn a lot from the way cannabis regulation has played out in the United States. Much of the battle has gone over the past few years from simply whether we're going to decriminalize it to now the battle is how are we going to decriminalize and legalize it, and how can we do that in an equitable way that doesn't perpetuate the same class and race-based system of access to drugs, and that actually repairs the harms of prohibition. So some of the things we're fighting for in the US when it comes to marijuana legalization is, for example, one thing is not discriminating against people with previous criminal records. There's an initiative in Oregon that includes psilocybin decriminalization. But one of the things that is potentially problematic about it is that the level of, if you are caught possessing psilocybin, the level of penalty and violation you are assessed with depends on your criminal record. So if you have one felony on your criminal record or two felonies on your criminal record, you are assessed a higher level of penalty, which of course has a very discriminatory effect on people in heavily policed communities who are disproportionately have been arrested for drug crimes in the past. Some of the other things that we're doing is making to ensure that the tax revenue is reinvested in the communities that have been most harmed by the drug war. And also to include social equity programs so that the people who have been harmed the most by the drug war are able to be included in the industry and are not excluded from the industry, and that it's not only available to very wealthy investors. I think symbolic victories are not enough. We have the momentum for global drug policy reform is very strong right now. There is a lot of public and political support for it. It's changed as quickly as almost any other political issue over the past few years. A growing majority of people in the US and other countries support making marijuana legal, significantly reducing the role of criminalization in drug policy, treating drug use as a health issue rather than a criminal one. Yet, in many places, people who use ayahuasca and other drugs remain vulnerable to stigmatization, marginalization, and even criminal punishment. So I think we really need to interrogate ourselves and how do we build a world where legal ayahuasca makes sense and where it isn't just for the privileged people, while communities who have suffered the worst harms of the drug war remain marginalized. And ultimately, we must repair the harms of ayahuasca's prohibition and reduce the role of criminalization in drug policy more broadly. The prohibition of ayahuasca, like the prohibition of other drugs, is a legacy of racism, of colonialism, and the repression of indigenous cultures. As numerous countries move toward ending the criminalization of people who use ayahuasca and other drugs deemed to be illegal, I think people who use ayahuasca have a very critical role to play in moving broader drug policy reforms forward that could ultimately break the back of the global war on drugs.